Percent of women 18 to 35 say they have been diagnosed or believe they have a mental health condition. That's compared to 57% of men in the same group. With me now is Deepy, the CEO of the Ontario Association of Social Workers. Good morning. Glad you could be with us.
Thanks for having me. Hello.
So walk us through the findings. 2/3 of younger women are living with mental health conditions. What does that tell you?
Well, it's rather alarming. It made me sit up and take notice, certainly, that over 66% of women between 18 and 35 are suffering with a number of issues like sadness and depression and isolation. And some of them are even going undiagnosed. And so we know we've got to find ways to support these young women, especially in this age group, who are the future of many of our professions, our communities, and our families.
What are some of the potential reasons that women are feeling this distress?
Well, this age group, 18 to 35, is coinciding with a lot of new life challenges. Things like developing career choices, building your family, making decisions about childcare and starting a family, and then top isolation and coming out of the pandemic and the number of issues that people have felt as it related to financial pressures. That's very difficult for anyone, never mind someone who's in that age bracket trying to navigate new support services and trying to find ways to do that on their own.
And did your research look at access to mental health care? Did you go there?
It sure did. In fact, over 60% of our respondents told us that if they had reached out for mental health support, they were met with at least one frustration or barrier. That's a lot. It means that people who wanted help and needed support couldn't find it or couldn't get it because of a very complex patchwork system.
How will low-income women in Ontario get access to mental health support?
Well, we know that the answer is not just phoning up a mental health professional. We know it's not that easy. We need folks in the community like social workers who address mental health every day, over 22,000 of us, to be injected into the system in places where people are all the time, like in their communities, with their doctors, schools, families, family doctors. We need to find ways to support even our low-income families to be able to get access to those supports with connectivity. And sometimes that connectivity requires someone to help guide you and support you and get you to the right place.
Deepy, do we have a plan of action out there, or do we need a plan of action?
We need a plan of action. We need to be able to invest in our communities. We need to invest in putting social workers and mental health professionals in places that people are each and every day. For our young people, that's in schools. For a community, that's in shelters and crisis, in healthcare and emergency departments, right across the system, in doctors' offices. That's where people go every day. We're asking our government to fund social work and permanent mental health supports in our community permanently.
Deepy, thanks for your research on this and for highlighting it on this International Women's Day. Really appreciate your time with us.